Hi, you guys. Welcome back for our daily practice questions. Today is day 39, and as always, I like to first get into my introduction and disclaimer before getting started with our questions for today. For those of you who are familiar with me, hey y'all. For those of you who are new here, welcome, welcome, welcome. I am Dr. Brittany Weinstock. I am a family nurse practitioner, and I am the founder and CEO of the Nursing Studio. I provide resources, tools, review courses, review videos, digital flashcards, Q banks, one on one sessions, and more to assist nurses as well as nurse practitioners with success on their boards as well as in practice. I've been doing this since 2015, assisting nurses and nurse practitioners internationally with exam success. Now, y'all know my disclaimer and reminder is that there's no absolutes in medicine. We treat on a patient-by-patient basis, and any of the questions that you see here, I have designed and created based on the current guidelines that are being tested on the ANCC as well as AANP exam. Now, any of my videos where I'm teaching on things that we currently do in practice, I will always say that so there's no confusion. So with that being said, let's get into question number 1 for today. Question number 1 states, a 45-year-old male presents with a total cholesterol of 240 milligrams per deciliter, an LDL of 140 milligrams per deciliter, triglyceride levels of 550 milligrams per deciliter, and an HDL of 40 milligrams per deciliter. He has a history of obesity and type 2 diabetes. What is the first-line pharmacologic treatment for his hypertriglyceridemia according to current guidelines? Is it A, statins, B, fibrates, C, niacin, or D, omega-3 fatty acids? Take a moment and tell me what you got in the comments, y'all. All right, so y'all know I always recommend reading the stem of the question first, as it allows you to slow down to ensure you're answering what is even being asked of you, right? So here the stem of the question states, what is the first line treatment for his hypertriglyceridemia according to current guidelines, right? So that tells you right here, the stem is letting you know, forget all the other stuff that's going on in here. We are treating the hypertriglyceridemia, right? All right. And when you look at a lipid panel, I always tell y'all, if it's 500 or greater, the triglycerides take priority. We're going to look at that first, right? So it's 550. And you want to start to consider pancreatitis, right, in these scenarios as a potential cause. But remember what we discussed for first line management for hypertriglyceridemia, 500 milligrams per deciliter or greater, right? And the best answer is B, fibrates. And yes, like I say, you can use niacins and fibrates, but according to the current guidelines, fibrates are the top. So it's almost like when we talk about hypertension. So you know how it's more than one that you can use as first line therapy? Fibrates and niacin both are commonly utilized for first line therapy, but the captain of those are fibrates. Fibrates help on multiple levels, and it really aids in the reduction of those triglycerides and reduces the risk of pancreatitis, right? And as we know, these are common association and common causes for hypertriglyceridemia. That is why it supersedes the niacin, and also because niacin has that bad common side effect of the flushing. So fibrates and then niacin, okay? So again, that last one, the best answer would be. All right, question number 2. According to the ACC and AHA guidelines for hypertension management, which of the following is the recommended first-line therapy for a patient with hypertension, blood pressure ranging from 130 over 80 to 139 over 89, and they have a history of an MI and type 2 diabetes? Is it A, ACE inhibitors, B, calcium channel blockers, C, diuretics, or D, beta blockers? What do y'all think? All right, so let's get into the stem of the question. Stem of the question here states, shoo. Look, this is one of those questions that the question is the stem of this question, right? So according to the ACC and AHA guidelines for hypertension management, which of the following is the recommended first-line therapy for a patient with hypertension that has a history of MI and type 2 diabetes? Y'all, first thing you should run to is A, right? Because remembering, patients who are diabetic do need renal protection, and any of our patients who require renal protection should get an ACE inhibitor or an ARB as their first line, okay? ACE or ARB when we need renal protection. So in this case, ACE inhibitor is the best answer. All right, question number 3. A 60-year-old male presents to your clinic with a history of fatigue and dyspnea on exertion. On exam, you hear a systolic murmur, best heard at the apex of the heart and radiating to the axilla. The patient also reports chest tightness when walking uphill. What is the most likely diagnosis? Is it A, mitral stenosis, B, aortic regurgitation, C, mitral regurgitation, or D, aortic stenosis? Tell me what you got in the comments, y'all. Tell me what you got. Tell me what you got. All right, stem of the question here. What is the most likely diagnosis? Y'all know what I tell you. If they're asking for a diagnosis, we got to run it back and look at those assessment findings. So we got a 60-year-old male, came into the clinic, history of fatigue and dyspnea on exertion. On exam, we hear a systolic murmur that's best heard at the apex of the heart, and it radiates to the axilla. Now, y'all know what I tell y'all when we are working through murmur questions, right? To identify two things. Number one, is it systolic or diastolic, right? And here it states that it's a systolic murmur. Y'all know Brittany's Brilliance, my mnemonic for murmurs. The revamped version is men really are silly, right? Men really, mitral regurgitation, are silly. AS is aortic stenosis, right? So we know it has to be one of the two. So in this case, either C or D, right? Next, the second thing that I always tell y'all to pay attention to is the location, right? So where is it located? It says that it's best heard at the apex of the heart. So is aortic or mitral at the apex location? It's mitral, right? Aortic is at the base of the heart. Mitral is at the apex of the heart. I always say think MA. Mitral at the apex, right? And then think AB for aortic at the base. But mitral is at the apex, and also for confirmation, it states that it radiates to the axilla. Remember, systolic murmurs are the only ones that radiate. And then mitral is lower down, it radiates to the axilla, whereas aortic radiates to the neck, the carotids, right? So your best answer here is C, mitral regurgitation, right? Because that is the mitral systolic murmur, okay? All right, you guys, I hope you found this helpful. I wanted to mix all of the things that we reviewed for this week. We'll do the same thing on tomorrow. It'll be a variety of the stuff that we covered. And then heading into next week, we'll kick off some more of the cardiac questions. But as always, y'all know to like, comment, subscribe, and share with whomever you may think may find this beneficial as well. And make sure you meet me back here. But if you need any of the resources that I do offer, please feel free to reach out to the nursing studio by giving us a call at 803-400-6864. You can also shoot a text message to this number or shoot us an email to thenursingstudio, the number 1, at gmail.com. Everything that I offer is linked in the bio of this channel, including my website. If you scroll to the main page of this channel under the title, you will see all of those things. You just have to click the link button and it'll drop down and show you everything. But also, if you're looking to book any of my one-on-one sessions or custom packages or plans, y'all know I always say either call, text, or email because I prefer to speak with you first to gauge what you truly need to make sure you're booking the appropriate session type. All right, you guys, y'all know what to do. Y'all make sure y'all meet me back here. Happy studying. Bye, y'all.